Welcome to Meaningful Mondays with the Community Foundation of Middlesex County, where we only know good people who do great things in our community. Whether you are a volunteer, a donor, or a nonprofit organization, each episode of Meaningful Mondays will celebrate you, our friends and neighbors who have a deep passion for and commitment to improving the quality of life for all in Middlesex County. So let's kick off the week with great conversations with remarkable people, businesses, and nonprofits making a difference right in our own backyard. Well, happy Monday, everyone. Not only is Monday a great day and meaningful in Middlesex County, but every day in Middlesex County is meaningful, especially when we have someone like Terri DiPietro from Middlesex Health with us. And Terri, you are truly the rock star of the hospital. Don't let Ben hear that I've said that, but you are.
Thank you. Thank you, Cynthia.
So let's have you give a little bit of history about what you've been up to for the past multiple years.
I just celebrated my 35th year at Middlesex Health, and I've had a very diverse career here. I started out on the psychiatric inpatient unit as the supervisor of the occupational therapy services. I was fortunate to be tasked with developing the day programs for psychiatry back in 1991. That was a long time ago.
Oh my gosh.
And my role grew thereafter. I went from just doing the day programs to then I started overseeing the mental health clinic. Then I took over the child mental health clinic. And through the years, through community partnerships, I was able to bring, with the partners in the community, really wonderful services here in Middlesex County. So we have a multitude of grants that provide services for children and families that came from those partnerships. It has never been my strength to be a grant writer, but I partnered with people who were excellent grant writers. And then I worked with the hospital leadership to convince them that Middlesex should take the lead on the programs.
Oh my gosh. And it culminated just a couple of years ago with the grand opening of your new center that I know you're very proud of. So let's hear a lot about that.
Yeah. So I will tell you, we searched for that building for 20 years. We were previously in 9 different locations, all within a 3-block radius. But it's a lot to try to manage all your staff and your services when you're so spread out. So the hospital invested a lot in us because they believed in the need for good mental health services. And so there was an opportunity to move into the old assisted living building, which was still in very good shape, and it's beautiful. And so we moved there. And I used to joke with my boss, who's Kelly Heckel, the VP of nursing, that when I went, I was going to get on the ground and kiss the sidewalk because I was so thankful for the building and the opportunity. But then I told her if I got on the ground, I wasn't sure I could get up. So I did not do that.
Would have helped you, Terri.
Yeah, but I was so thankful for that. And then I used to walk through the building and I used to say to the patients, "What do you think of our new space?" And mostly because it was an assisted living facility, in every office had at least 4 windows. The waiting rooms had multiple windows. So there's all this natural light. It had been refurbished. It was just beautiful. And people felt valued.
You know, that's so true. We so often overlook our surroundings and what it does for us. The environment really does have an impact. And I've been there several times, and I'm always so impressed that everyone, anyone who's in that building is so grateful to be under one roof, because you and I both know that lots of ideas just happen as you're passing in the hallway. So I'm sure the staff is just ecstatic.
And it offered an opportunity just to do a walkthrough and check in with people, see how they're doing,
right,
with both the patients and the staff. Because our staff are our greatest resource, especially in mental health, because we don't rely a lot on technology. We rely on our people.
And remind us what building you're talking about, because you had some wonderful community members come forward and help you with
Yes.
that.
So it is One McDonough Place located, and it is 54,000 square feet. We were able to fit all our services into one location. We have greater security, greater control of the building. In this day and age, security is important, and it allowed us to have central points of access and use badge access for other areas to keep the staff and the patients safe. And so it was a beyond fabulous opportunity. Some of our buildings that we used to be in didn't have heat or they leaked or, and this building is just, it's as close to perfect as you're ever going to get.
And kudos to the Beat family, Paley families for believing in what you were doing and for coming forward. And what a wonderful, they must be so honored to have their names on that building.
I do. I hope so. And I have to tell you, they were two very interesting men. And so I spent one afternoon with them, just about an hour and a half. And I had never, met with such large donors before. But they told me asked me what my visions were, and their mandate was they wanted improved access to mental health services. So I told them what we would do with that money. And at the end of the hour and a half meeting, he said, "Okay, you got it." And I was floored, Cynthia. I was floored.
That's great.
And it was a very generous donation. And so it has allowed us to get our staff specialty training. It has allowed us to do things for our patients. It has been really fabulous.
Uh, and we always say we only know good people who do great things. You're one of them. And then certainly those wonderful donors
Yes.
believed in what you were doing, because I know how passionate you are about that. So, you know what? We always at the Community Foundation talk about connecting the dots. And with your new role as Director of Community Partnerships at Middlesex Health, tell us about that. And and tell us, because this is about the payback for giving back, for connecting the dots. Tell us what your role entails and
Okay.
what you love about it.
And the payback isn't necessarily in direct dollars, but it does come in dollars. So I work with most of the community providers that touch the lives of people with mental health issues. So that's everything from the homeless to the local mental health authority who works with patients who have severe and persistent mental illness, um, and everybody in between. And so opportunities come for us to work together. And we have developed such strong relationships that we call upon each other. So when there is a patient here at the hospital with a particular issue, sometimes I'll give you an example. Often it can be someone who's homeless. And so I reach out to my partners that do that kind of work. And the first response everybody gives is, no housing. And I'm like, okay, but so what could we do? And most times we're able to come up with some kind of plan, patchwork plan that gets this person in the direction that they need to go. So the benefit to the hospital is anybody who's sought care in a medical system, there's a bed shortage. The EDs
Mhm.
are overcrowded. So everybody that we can move on to their next level of care and have them be successful there is a benefit to the hospital. And so that's why it's worth the hospital's investment in my having these relationships with people.
Because you can't all do it, can't do it all yourself. And that's a horrible way of saying it, but you know what I mean. Is I have this vision, and I use this phrase a lot. I envision you and your partners as this warm, encompassing blanket, just protecting the people and getting them on the right path. So thank you for that.
Yeah, and that I think is a great analogy. But I will think what happens also with the partners, myself included, is this is really tough work that we do.
Mhm.
And so we support each other in that work so that we can continue to be energized to do that work. And you can't do it on your own. And there are some days that are harder than others. But again, so there's a story a lot of times there's a lot of elderly people becoming homeless. It's amazing to me the numbers, they're so high. And so we have this gentleman, he can't go back to where he was living because there's no water, there's no heat, and it's the winter time. So, I get together with my hospital colleagues, we come up with a plan. He's going to go to a hotel. But then, the gentleman how's he going to get to eat, right? His daughter lived in Alaska, coming 5 days later. So I contact my contact at St. Vincent's, Mary Ellen Shumway, and I say, could you feed him for 5 days? And she arranged to bring food to the motel that he was at. And so the hospital arranged for him to have a roof over his head. And she arranged to make sure he was fed because he would have ended up coming back to the hospital if he couldn't get his basic needs met. So do you see how it benefited the hospital?
It's right. And it's connecting the dots. And thank goodness for Mary Ellen Shuckero. She's
Yeah,
another rock star. I mean,
yeah,
real, you
absolutely.
all are. You all are. But again, I don't think we stop enough, Terri, during our day to day to think about if we weave everything together, we can accomplish a lot. And we don't, I know you don't, but I know a lot of you and your colleagues don't take enough time to pat yourself on the back about what you do. Because if you're helping just one person, that's to me a gold star right after your
Yeah.
name. And as a former first grade teacher, I gave up gold stars.
It's interesting because I used to teach very part-time in the occupational therapy program at Winnipeg. And I used to say to my students, when I'm not enjoying what I do anymore, it's time for me to give it up, to stop doing it. But it's amazing to be and I've had a lot of opportunity. I've done different things here at the hospital, but to have worked in one place for 35 years and say you still love what you do.
And that the 35 years in and of itself is a testament not only to you, but also to the hospital because
Absolutely.
they value you as a resource and they've always found they're finding ways to increase your skill sets, number one, and
Yeah.
expand the use of your expertise. So, is there anything in your storied career over the years that truly you would say that's the memory that I'm always going to keep? Do you think?
Yeah. I think it's hard to choose one. I mean, I think, I often think about when I started in outpatient mental health, and we were so tiny because back then hospitals didn't have big outpatient
Right.
services. And we grew into a very large, robust service. We started like day treatment. We started with one, and then when we ended, we had 9 different tracks that we served. Um, and we, in the outpatient clinic where people received like traditional therapy, the child clinic had one therapist and 5 hours of a child psychiatrist, and the adult clinic had like 3 therapists and one psychiatrist. And I think we're up to 9 psychiatrists now, and I
Oh,
don't even
wow.
know, about 20 therapists. So all that, but again, that shows that Middlesex had an understanding of the importance of mental health in the overall well-being of their patient population. And I got to tell you, I have colleagues across the state. I don't know that every organization gets that. So I have felt fortunate to work at a hospital that does.
And why do you think, or let me rephrase it, how do you think we all can work together to diminish the stigma about mental illness? And I always try to talk about it as mental wellness.
Right,
And
right.
and so is it simple little things by turning a phrase like mental illness into mental wellness?
Right.
How can we in the general public help you?
I think the biggest way that people can help is to tell their own stories. I would say to you, Cynthia, I don't know many people who haven't been touched by some form of a mental health issue, right? Either yourself or your direct family or your friends. It's impossible that somebody in your circle of life has not experienced that, or even yourself. But yet because of stigma, people are apprehensive about sharing. I oversaw the employee assistance program for many years, and employees would come And some of the employees would be higher tier employees, and they would say to the employee assistance worker, well, I don't want Terry to know that I'm here. Which has always felt like hurtful to me because I was so happy they were there. But then I was like, wow, we'll know that we've made it when they don't feel like they have to not let me know that they were there.
And we need honest conversations now more than ever.
Absolutely. I totally agree.
And really, we need to put that warm blanket around our young people too, because they've suffered and lived through a lot over the past several years.
Absolutely.
So, the theme of our podcast lately is the payback for giving back. And you give back in so many ways of yourself. You do, and your energies and your talents. So, what would you tell everybody is the payback?
Yeah. So the payback is, I've always, people who know me would say my creed is that the patient always came first, right? And I found when I did the right thing by the patient, then there was a sense of self-fulfillment that you don't get from anything else, you know? So to know that you had a small piece of helping that person move forward in their life or to regain some kind of semblance of control over themselves, there's no, the feeling is just, you can't, there's not one that's, there's very few that are better than that. Certainly the love of my kids and my grandkids is a wonderful feeling, but when I get satisfaction from the work I'm doing, and when I mean I get satisfaction from connecting people to the things that they need and seeing them to be able to advance.
So, I'm going to put words in your mouth. So, do you think your advice to everybody out there is to do what you love, try to help somebody in your life or even a stranger? The kindness and thoughtfulness that we need to spread is so important.
Yes, absolutely. And can I tell you, my latest campaign is kindness and compassion are almost starting to be missing a little bit in healthcare. And to me, they are the secret sauce. If you have kindness and compassion, we have a lot of expertise, but if you don't have kindness and compassion, you don't have what you need. People need to know that somebody cares, that they get that.
And that they belong. So I think that's well said.
Or understands where they are, the vulnerable space where they are.
And allows them to be vulnerable. And really, and to care. So the kindness and caring, that's well, Terri, I don't know how I'm going to top that. My goodness gracious, you are an amazing person. So is there a question that I should have asked that I didn't ask?
I think we've kind of covered it, most of it. Again, my other mantra that I say to people is I have to travel in hope. So, there's a lot going on in our government, there's a lot going on in our financial world, but I have to believe the only way I can do what I do is that it's going to happen. And I've seen it over 35 years. I've always thought, oh, well, we'll never get that done. And somehow we get it done.
Yep. And my mantra is hope is not a bad 4-letter word. It's a good one.
Yeah. So, I think we have to sustain our hope, and that helps us to stay resilient in some of the issues that we're facing. And that's that's kind of what we need.
And Terri, we're so fortunate to be surrounded by so many great people where we live, work, and play. So
absolutely, especially Middlesex County, I'm telling you.
Oh,
I have a lot of colleagues across the state, but I learned very early in my career, Middlesex County is so special.
You are so right. And you are the rock star of being special. So after all of that, after 35 years in your new role and enjoying it, what are you looking forward to in the next month or so?
So, actually, my dream being, I have about 3 more years till I retire. My dream is to be able to start a medical respite program in our community. So we have shelters, but if you or I are sick, we go home to our house and we get home care or we have family and friends take care of us. But when there are individuals, if you're already homeless and you're sick and you have to go to a shelter system to recover, and I don't know if everybody knows, but in the shelter system, you have to leave at 7 o'clock in the morning. You don't come back till 7 o'clock in the night, and you're sick. How do you do that? And so it's a huge, huge climb because finding the funding to do something like that is daunting. But I'm taking it a step at a time. I've reached out to partners in the state and to partners in the community. Everybody agrees it's a much needed service. We just have to figure out how we're going to move it forward.
Knowing you, it will be done before you retire. And
I hope so. That is my goal.
But anybody listening to this, if you can help, Terri, is there a way to connect with you? Seriously, you ought to throw out
people can always connect with me through the hospital. My direct line is 860-358-8802. And all the hospital emails are the same. It's my name, Terri with an I, Terri. Last name is DiPietro, DIPIETRO @midhos.org.
All right.
I would be anybody, or even if you're just interested in being part of the process, I would welcome any help I could get.
Well, we're going to throw that out to the universe, and okay. I'm going to go out on a limb and guarantee before you retire that will happen.
I hope so. I hope that's the next grand opening that you're coming to, Cynthia.
All right. Well, Terri, you are the best, and I thank you for all that you do, and thank you for sharing your mantras, your wonderful words of wisdom, and thank you for what you've done for so many people over 35 years.
I truly appreciate the opportunity to have done.
All right. You take care.
Thank you. Good to see you.
Good to see you. Thank you for joining us for this week's episode of Meaningful Mondays. At the Community Foundation of Middlesex County, we know that philanthropy matters and philanthropy works. Together, we support the arts, education, human services, animal welfare, the environment, heritage enhancements, and so much more by providing services, programs, and grants to our local nonprofits. We invite you to learn more and share your passion with us. Visit us at middlesexcountycf.org or contact us at 860-347-0025. Together, we can make great things happen.